So if you live anywhere that isn't, right on the equator, you know that feeling. It's that transition, late fall, early winter, and you just feel this gravitational pull toward the couch. The mornings are basically just a suggestion of daylight, and then boom, it's 5 p.m. and it feels like the middle of the night. It's just this sluggishness, this low energy feeling that makes you want to cancel everything and just eat comfort food.
That feeling is incredibly common. But it's so important to understand that it's more than just, a preference for sweaters and soup. We're talking about real, measurable, physiological shifts inside your body. And they're tied directly to how quickly and how severely that daylight exposure drops off.
And the numbers are just startling when you look at them. We were looking at data for cities at higher latitudes, so take somewhere like Portland, Oregon. It's pretty far north. On the winter solstice, that's December 21st, the shortest day of the year, they get just under 9 hours of daylight.
Just under 9. And compare that to the summer.
Exactly. On the summer solstice, they get over 15 hours. So that's a massive 6-hour drop in bright light. And that is the biological trigger we are diving into today.
It is. And that huge seasonal shift can lead to something, well, much more serious than just the casual winter blues. Our mission today is a really comprehensive deep dive into seasonal affective disorder, or SAD. We've pulled together this whole stack of health and scientific research to figure out, what exactly is SAD? Why does this lack of light cause such dramatic mood changes inside the brain? And, maybe most importantly, what are the best, most evidence-based strategies for treating it, for preventing it? Everything from specialized light boxes and targeted therapy to some very specific lifestyle and supplemental strategies.
This is truly knowledge for application. And if you take just one core thing away from this dive today, let it be this. SAD is classified as a type of major depressive disorder. It's serious. But because its cause is predictable and it's environmental, it is exceptionally treatable.
That's the key. The management of it really comes down to recognizing how important it is to consistently support your brain chemistry and, maybe even more critically, to synchronize your body's internal clock all through those darker, shorter months.
Okay, so let's unpack this a little bit. We throw these terms around all the time, right? Winter blues, SAD. We kind of use them interchangeably. But our sources make it abundantly clear that clinically, they are profoundly different experiences. So what exactly is SAD and where does it cross that line from just a common seasonal slump into an actual clinical diagnosis?
Right. So formally, seasonal affective disorder is classified in the DSM-5. It's a major depressive disorder, but with a recurrent seasonal pattern. That's the key phrase. And in the vast majority of cases, what we call winter pattern SAD, the symptoms. They reliably start in the late autumn or early winter, and then they typically just sort of go away on their own when spring or early summer hits. So you have this pattern, this depressive episode that lasts for about 4 to 5 months out of the year, every single year.
So if the symptoms are similar to what we think of as general depression, low mood, fatigue, what is the specific thing that differentiates them? What separates the person who just feels a bit gloomy and wants to stay home from the person whose life is genuinely being impaired by the season?
It really boils down to 2 things: functional impairment and distress. Almost everyone experiences some version of the winter blues. That's just a common mood shift. You might feel a little sadder, a bit more lethargic. Maybe notice you have less motivation. You might choose to, hunker down, as you said, cancel a few plans, feel a bit gloomy.
But you can still function.
Exactly. And crucially, you can still enjoy life. You can still function day to day, even if you have to push yourself a little harder. You still look forward to your hobbies. You still engage with them, even if your energy feels a bit low.
But when that functional line is crossed, that's when we enter the territory of actual clinical SAD.
Precisely. The symptoms of SAD are debilitating. They're not just an inconvenience. They interfere significantly with your daily functioning, at home, at work, at school, and critically, in your ability to maintain healthy relationships. It involves a genuine loss of interest or pleasure in most things. The clinical term is anhedonia, and as one of our sources describe it, activities that you once treasured, like, say you're an avid hiker or a baker on the weekends. Those things can suddenly feel like impossible tasks.
Wow, so it's not just sluggishness, it's a global shutdown of your ability to engage with the world.
Yes, this is depression on a global scale. It affects your core identity, not just your energy level.
And the diagnosis itself, it's not just based on having one bad winter. It has to be predictable, right? Which is why the criteria are so strict.
That's a key point. To get a formal diagnosis of SAD, these depressive episodes have to happen during a specific season, in this case winter, for at least 2 consecutive years.
Hmm.
And, this is the important statistical part, the seasonal depressive episodes have to be demonstrably more frequent than any non-seasonal depressive episodes you might have during the rest of the year.
So that's how they separate it from, say, chronic depression that just happens to peak in the winter.
Exactly. This strict criterion establishes that recurrent, predictable nature of the disorder.
And before we move on, we should probably clarify another term that gets thrown into the mix around the end of the year: the holiday blues.
Oh, that confusion is so pervasive, especially once we hit November and December. The holiday blues typically describe symptoms of depression or sadness that happen, between Thanksgiving and New Year's. But these symptoms are often related to external stressors, not a lack of light. We're talking about social pressures, feelings of loneliness that get worse because of holiday expectations, maybe grief over losing a loved one, or even just the financial strain of it all.
So the symptoms might feel the same, that low mood, irritability, but the root cause is totally different. One is sociological and psychological, the other is photobiological.
Correct. The holiday blues are not directly caused by a lack of daylight. Although, we have to acknowledge, if you're already prone to SAD, you're probably more likely to experience the holiday blues at the same time. I mean, you're already in a depressive state when all those social stressors hit. So the two can definitely overlap and just compound the misery.
Right. And while our deep dive is really focusing on the winter pattern, because that's the vast majority of cases, you did mention there's this inverted, less common version of SAD.
Yes. Summer pattern SAD, or summer depression. This is where the depressive symptoms actually start in the spring or early summer and then resolve in the fall or winter. It's estimated to affect less than 1% of the population, so it's much, much rarer. And while we know less about its specific cause, the thinking is that the mechanism is tied to disruptions from heat, from humidity, and maybe the extended light exposure messing with sleep, which is the exact opposite of what triggers the winter version.
Okay, this is where it gets really interesting for me and where we need to spend some serious time to live up to that deep dive name. Once we've established that it's the lack of light triggering the depression, the central question is, why? What are the intricate biological mechanisms that link less sunlight directly to that debilitating low mood and fatigue? What is fundamentally happening inside our brains that makes them respond so dramatically to just a few hours of darkness?
It all comes down to the body's master timekeeper, the circadian rhythm. This is our innate internal 24-hour clock. It's housed deep in the brain in this tiny cluster of about 20,000 neurons. It's called the suprachiasmatic nucleus, or the SCN for short. The SCN is the master regulator. It controls everything: sleep-wake cycles, metabolism, hormone activity, digestion, even your core body temperature.
And daylight is like the crucial high-intensity reset button for that entire system.
Exactly. Light doesn't just let us see, it communicates directly with the SCN. There are these specialized photoreceptors in the retina, the back of your eye, called IPRGCs for short. And what's crucial is that these cells are highly sensitive to blue light, which is really abundant in bright daylight, and they transmit information about light intensity directly to the SCN.
So when the amount of that natural high-intensity blue light is significantly reduced in the winter, that essential signal to the master clock is just, it's weak, or it's non-existent.
Precisely. The whole system is disrupted. And because the SCN sends out signals that influence mood-regulating areas of the brain, like the prefrontal cortex, that's the area for emotional regulation, complex decision-making. When the SCN is out of sync, your mood and your cognition are immediately affected. Your internal clock is basically running on faulty data or delayed data. The whole system of daily synchronization just fails.
And that disruption affects those two big chemicals we always hear about with mood: serotonin and melatonin. Let's start with serotonin, the key mood neurotransmitter. How does low light specifically affect its availability?
Well, studies show that people with winter pattern SAD have reduced functional levels of serotonin. The sources suggest that the shorter daylight hours might prevent the molecules that maintain normal serotonin levels from functioning properly.
Can we break down how that happens? Because the sources point to this one key piece of research that really just shines a light on why SAD sufferers are so vulnerable.
Yes, this is the profound insight we really need to spend time on. Brain scans have shown that people who experience seasonal depression in the winter have higher levels of a specific protein. It's known as the serotonin transporter protein, or SERT.
SERT.
Okay, think of SERT as the body's recycling crew. Or, to be more dramatic, like a vacuum cleaner, Its job is to retrieve serotonin from the synapses, that's the space between nerve cells where the signal is passed, and transport it back into the original cell.
So if you have high levels of this transporter protein, it means your brain is cleaning up the serotonin too efficiently. It's removing it before it can fully do its job of lifting your mood.
That is the perfect analogy.
Yeah.
People with SAGE are essentially clearing out their mood-regulating serotonin more efficiently and probably faster than people without the disorder. During the summer, all that abundant light somehow helps to regulate or suppress the activity of this SERT protein, which keeps serotonin levels up. But when that light input decreases so drastically in the winter, the SERT proteins just ramp up their vacuuming activity. They rapidly reduce the available serotonin.
Wow. So this makes people with SAD acutely sensitive to any drop in light. Their brains are basically chemically primed to struggle when the days get shorter.
That is genuinely astonishing, isn't it? It's not just that they produce less serotonin, it's that they dispose of it faster. It's a double whammy, and it's caused by external light conditions.
Yeah, that's a critical distinction. It moves SAD beyond just a simple chemical deficiency and ties it directly to this light-driven regulation.
Right.
Okay, now for melatonin, the sleep hormone, this one seems to be the culprit for that extreme fatigue and hypersomnia we see in winter SAD.
Yes. So melatonin is produced by the pineal gland, and its production is inversely proportional to light. It increases in the dark to signal sleepiness. In winter pattern SAD, the body may produce melatonin in higher than normal levels, but more importantly, the timing is all thrown off.
How does the timing get thrown off?
Well, because the sun rises later and the light is dimmer, the signal to stop melatonin production in the morning is delayed. The body's whole melatonin cycle, its sleep phase, starts too early in the evening, and it persists way too late into the morning.
So that lingering presence of the sleep hormone is why getting out of bed on those dark winter mornings feels like this monumental struggle.
Exactly. You're chemically groggy. You're experiencing what's called a circadian phase delay. Your body's telling you it's midnight when your alarm clock says 8:00 a.m., and that disruption just throws the entire daily sleep-wake cycle into chaos.
It's the ultimate uncontrollable I need to hibernate signal coming straight from the brain, all driven by this delayed clock.
Absolutely. The body's daily rhythm, it just can't adjust properly to the seasonal change in day length, and that leads to the full suite of SA symptoms. The mood changes, the sleep problems, the altered appetite.
And in terms of who this affects, we know latitude plays a huge role. If you live closer to the poles, you're at a higher risk just because the sun disappears for so long.
That's correct. SAD is highly correlated with latitude. It's far more prevalent in people who live far from the equator where those winter daylight hours are drastically shorter. Prevalent studies in the U.S. show a really clear gradient. In Florida, the prevalence is near zero, but in a place like New York, it's about 4.7%. And as you move further north, that rate only goes up. It's also statistically more common in women and adults. It's less frequently diagnosed in children, teens, or older adults.
But even within those high-risk populations, there are these fascinating outliers that really just underscore the power of lifestyle and light exposure. That example of the Amish community we found in the sources was amazing.
This is such a powerful, almost accidental controlled study that supports the whole light exposure theory. Studies of Amish communities in the U.S. show some of the lowest SAD rates ever recorded among Caucasian populations. And we really need to pause and think about why this insight matters so much.
It suggests that your culture, your genetics, your environment, they're all secondary to one thing: light exposure.
Exactly. The key difference in their lifestyle compared to the general population. They spend significantly more time outdoors, doing manual work, daily activities. They maximize their natural light exposure, even on cloudy winter days. And on top of that, they use less electricity. So they're less exposed to bright, artificial light at night, which can also confuse that circadian clock. This sustained high exposure to natural light appears to be highly protective against the very circadian disruption that drives SAD. It basically proves that proactive behavior can override a predisposition.
Okay, so this brings up a really important question. Given how severe and how frequent these symptoms can be, what specific things should you be looking out for that differentiate these unique winter pattern symptoms from, say, generalized non-seasonal depression?
That distinction really comes down to that hibernation pattern you mentioned. It's a metabolic shift. It's the specific changes in energy and appetite and sleep that seem to be the body reacting to the environmental cue of less light. It's almost like the brain misreads the season and just goes into survival mode.
That is the perfect way to frame it. So while SAD includes all the core symptoms of major depression, that persistent, sad, anxious mood, feelings of hopelessness, difficulty concentrating, loss of interest. The winter pattern adds these very specific, almost vegetative symptoms that clinicians look for.
Let's start with sleep, because the pattern is so different from typical depression.
Right, it's almost the opposite.
Exactly. In many non-seasonal forms of depression, insomnia is the hallmark. You have trouble falling asleep or you wake up way too early. In winter pattern SAD, the hallmark is often severe hypersomnia, pathologically oversleeping. People struggle immensely to get out of bed in the morning. They might sleep 10, 12, even 14 hours and still feel completely exhausted. And this lines up perfectly with that melatonin imbalance and phase delay theory we talked about. They feel constantly slowed down, just as overwhelming fatigue and lethargy.
And the appetite changes are also inverted compared to classic depression, which often involves weight loss or a decreased appetite. This is the part that leads directly to those comfort food cravings.
Yes. With winter SAD, there's typically a highly increased appetite, specifically a really pronounced, almost uncontrollable craving for high-density, rapidly absorbed foods. So, carbohydrates, sugary treats. This craving is basically the body trying to self-medicate, or maybe seeking quick energy to fuel its simulated hibernation, or maybe it's trying to boost that flagging serotonin. And this can be exaggerated and lead to unplanned weight gain, which then, of course, can make feelings of low self-esteem and depression even worse.
So if you're experiencing severe oversleeping, fatigue, and these intense carb cravings that are leading to weight gain, that collection of symptoms is a huge red flag for the winter subtype of SAD. What about other behavioral symptoms?
There's a marked social withdrawal. Sufferers often describe it as hibernating. They actively pull away from friends, from family. They lose interest in activities they normally love. And when you combine that with the decreased physical energy, it leads to significant avoidance behavior. Other symptoms can include irritability, frustration, an unusual sense of restlessness, and a loss of sex drive. It just makes the whole season feel inescapable, incredibly isolating.
So if a person recognizes these signs in themselves, especially if they see that 2-year pattern emerging, what's the first step for an official diagnosis?
The diagnosis is purely clinical. It's based on a really comprehensive assessment of your symptoms and, crucially, the timing. There are no specific lab tests to diagnose SAD itself. Your healthcare provider will do a full clinical evaluation, asking extensively about your symptoms, your thoughts, your feelings, and your behavioral patterns over the course of the year. They also might use structured questionnaires designed specifically to assess for seasonal changes.
But they do run blood tests to rule out other issues, which is really important to mention.
Absolutely. The clinician will often do a physical exam and order lab tests, like a complete blood count, or check your thyroid hormone levels. This is to make sure that the symptoms aren't being caused by an underlying physical problem, like hypothyroidism, which can mimic a lot of SAD symptoms like fatigue and weight gain. Checking vitamin D levels is also very common, since so many people with winter pattern SAD have a clear vitamin D deficiency that needs to be addressed on its own.
It sounds like the key is just paying rigorous attention to the patterns and the degree of functional impairment. And for younger people, for kids and teens, the signs might look a little different too.
They absolutely can. Children and teenagers with depressive symptoms might say they feel more annoyed or persistently bored, rather than saying they're sad. You might observe them struggling to leave their room or bed for long periods, or see a marked drop in their grades and performance at school. If these kinds of symptoms are causing distress and impairing their functioning, especially if they recur seasonally for at least 2 years in a row, it really warrants a professional evaluation right away.
So, given that the cause is largely understood, it's this lack of light messing with the biological clock and serotonin, the great news is that we have these highly effective evidence-based tools that tackle the problem directly. We have 3 main categories here: light, talk, and medication. Let's start with light therapy, or phototherapy, which has really been the cornerstone of treatment since the 1980s.
Yeah, light therapy is considered one of the first line and most accessible treatments for fall-onset SAD. The mechanism, as we've established, is direct. It aims to expose you to bright light to mimic the intensity of the summer sunlight that's missing in winter. This high-intensity light hits those special photoreceptors in the retina, sends that strong signal to the SCN, and that helps suppress the lingering melatonin and directly influences those mood-regulating pathways in the brain.
But this isn't just sitting near a bright desk lamp, right? You need a specialized light box designed specifically for this. What are the protocol details for it to be effective?
Right. The standard protocol involves using a specialized light box. Definitely not a tanning bed, not a regular lamp, at a really high intensity of 10,000 lux. And to put that into perspective for you, an average well-lit office might be around 500 lux. So we're
Wow.
talking about 20 times that intensity to mimic natural sunlight. And the recommended daily duration is between 30 to 45 minutes of exposure.
And timing is everything,
Yes.
correct. Based on that circadian phase delay we were talking about, when is the optimal time to use this therapy to really reset that internal clock?
The ideal time is typically within the first hour of waking up in the morning. That early morning exposure is crucial because it delivers that synchronizing signal to the SCN right when it's most sensitive to correction. It essentially tells the body it is morning, stop producing melatonin, and that helps to pull the circadian phase earlier and suppress that grogginess. The light box must also filter out any potentially damaging UV light, so it's safe for daily use for most people.
That seems like such a simple intervention for what is a serious depressive disorder. How quickly and effectively does it actually work?
Light therapy is generally very well tolerated. It causes few, usually mild side effects, like maybe a minor headache or some eye strain at first, and it often works relatively quickly. You'll usually see clinical improvement within a few days to a few weeks, which is often faster than you'd see with antidepressants. Its overall effectiveness is quite impressive. It's comparable to antidepressant medications or psychotherapy, improving symptoms in about 40 to 60% of people.
And should people stop using it once spring arrives?
The treatment should be continued consistently until your symptoms spontaneously remit when the natural daylight levels increase enough in the spring or early summer. If you stop abruptly before the season changes, it often leads to a relapse. And because SAD is so predictable, a lot of individuals also use it preventatively, starting the therapy weeks before their symptoms typically begin in the early fall.
And we have to pause here to issue the critical warning that's associated with light therapy, especially for people who might have pre-existing conditions.
Yes, anyone considering light therapy must consult with their healthcare provider first. This is especially important if you have certain pre-existing eye diseases like glaucoma or cataracts, or if you're taking photosensitizing medications. Those are drugs that increase your sensitivity to sunlight, like certain antibiotics or dermatological medications. In those cases, light therapy could potentially cause harm, so you'd need alternative treatments or at least very careful medical supervision.
Okay, moving on to talk therapy. Cognitive behavioral therapy is a cornerstone of depression treatment everywhere, but there's a specific version tailored for phys-AD called CBT-SAD. This is more than just talking through your feelings, isn't it? It's about building resistance.
It is about building resistance, or what we call adaptive coping skills. CBT-SAD helps individuals fundamentally change the unhelpful thoughts and behaviors that contribute to their seasonal depression. It's often very structured, typically delivered in weekly sessions over about a 6-week period.
And what are the two core elements of CBT-SAD that make it so effective against that seasonal pattern?
So the first core element is called cognitive restructuring. This involves working with a therapist to identify and then actively replace those negative or catastrophic thoughts you have about the season. So thoughts like, I hate winter, this is going to be miserable, or I'm always depressed when the sun goes away. And you replace them with more balanced, positive, and manageable thoughts. Something like, winter is harder, but I have tools to manage it and I can plan around the challenges.
That seems like a direct counterforce to that feeling of inevitable doom that the season can bring, which is so common for SA sufferers.
It is. And the second critical component is behavioral activation. This involves helping people identify and then actively schedule pleasant, engaging activities, whether they're indoor hobbies or outdoor social things. The whole point is to deliberately offset that loss of interest and social withdrawal they experience. If your instinct is to hibernate, behavioral activation forces structured engagement. This might mean scheduling a specific time every week to meet friends, or pursuing a new indoor craft, or deliberately seeking out a winter sport.
And studies suggest that the psychological tools you learn through CBT might offer this unique long-term advantage over just using light therapy alone. This is a huge takeaway for you if you're listening.
This finding is profoundly important for long-term prognosis. Research has shown that CBT, used either alone or with light therapy, was associated with a statistically significant reduction in the recurrence of depression in later winters compared with light therapy alone. Light therapy is powerful while you use it, but once you stop, the effect is gone. CBT gives you lasting, protective psychological tools that carry over year after year. It offers a prophylactic benefit against future episodes.
Finally, let's talk about medications. When are antidepressants recommended for SAD, and how do they fit into the treatment plan, especially considering that serotonin transporter issue?
Antidepressants, Specifically, the SSRI's selective serotonin reuptake inhibitors are a mainstay treatment, particularly for individuals with severe SAD symptoms, or for those who haven't responded fully to light therapy or CBT. And given what we know about that elevated serotonin transporter protein in SAD, SSRIs work by blocking the reuptake, the vacuuming up of serotonin into the nerve cells. This leaves more serotonin available in the synapse, which enhances its effect on mood regulation.
That makes perfect sense. If SID involves too much vacuuming, the SSRI blocks the vacuum cleaner.
Precisely. However, it's essential for you to remember that it can take several weeks, typically 2 to 6, to notice the full therapeutic benefits as your brain chemistry adjusts.
And can medication be used preventatively, much like light therapy and CBT SAD?
Yes, and this is a specialized strategy. For those with a clear history of recurrent SAD, an extended-release version of the antidepressant bupropion, often sold as Wellbutrin XL or Ablenzin, may be recommended for preventative seasonal use. The standard strategy is to start this medication before your symptoms typically begin in the fall, say early September, and then continue it past the time your symptoms usually go away in the spring, maybe through April or May.
And we have to issue that crucial medical warning, again, regarding bipolar disorder.
This is absolutely critical. If you have bipolar disorder, you must inform your healthcare provider immediately. Both light therapy and antidepressant medications carry a potential risk of triggering a manic or hypomanic episode in individuals with bipolar disorder. Because of this risk, medical supervision is absolutely essential to safely manage the treatment and ensure your stability.
Okay, now let's pivot to the proactive things people can integrate into their lives right now, especially around diet and supplements, which our listeners specifically asked about. Supplements are talked about all the time online, but we need to ground this in some solid, evidence-based recommendations. Let's start with vitamin D, the sunshine vitamin.
The link between vitamin D and SAD is highly compelling. Less sunlight in winter means your body synthesizes drastically less vitamin D. And since vitamin D deficiency is highly associated with an increased risk of depression in general, it's not surprising that many people diagnosed with winter pattern SAD are clinically deficient.
So given that deficiency is so common, what are the typical recommendations for dosage and sources?
The baseline recommendation for most healthy adults is between 600 and 800 international units, or IU, of vitamin D daily. However, for those who are confirmed to have a deficiency, a healthcare provider might recommend therapeutic supplemental amounts, often ranging from 1,000 to 2,000 IUs per day. Some might need higher doses at first. And beyond sun exposure, you can get it from dietary sources like fatty fish salmon, tuna egg yolks, and fortified foods like milk, orange juice, and cereals.
The science on whether supplementing specifically treats this SAD symptoms seems a bit mixed, though. Why the confusion there?
That's where the nuance is. While addressing a deficiency is always necessary for your overall health, studies that have tested vitamin D as a dedicated treatment for SAD symptoms have produced inconsistent results. Some smaller, older studies suggested mood improvement comparable to light therapy. But those results haven't consistently held up in large, randomized clinical trials when they compared high-dose vitamin D to a placebo in SAD patients who weren't deficient. The consensus now is that it's often a valuable addition to treatment, especially if you are deficient, but it's probably not a sufficient standalone treatment for clinical SAD.
That makes sense. Treat the deficiency first, but don't just rely on vitamin D to cure the depression. Now let's tackle that popular social media claim about combining vitamin T3 and vitamin K2 for mood. Is there any specific evidence for that combo for SAD?
Right, that trend toward combining D3 and K2 is rooted in general health claims, mostly related to calcium metabolism and bone health. Vitamin D3 is the form you need for boosting mood and your immune system. And while vitamin K is crucial for other things like blood clotting, the sources we reviewed note that it is not clear that vitamin K provides any specific therapeutic benefit for SAD symptoms or mood regulation. The advice from experts is generally to be cautious of taking high, unnecessary doses of either nutrient. Instead, stick to medically recommended vitamin D dosages or a general daily multivitamin if your main goal is addressing SAD. Basically, avoid mixing high-dose supplements without a doctor's guidance.
Okay, beyond vitamin D, what other supplemental options are backed by general depression research that might apply to a brain struggling with these seasonal shifts?
Omega-3 fatty acids are foundational. These are essential fats, specifically EPA and DHA, that your body can't produce. They are vital for the structure and function of your brain cell membranes. They're strongly anti-inflammatory and links to improved brain health. And while SAD-specific studies are limited, evidence from general depression research suggests they may help. A standard supplemental dose for mood support is typically 1,000 to 2,000 milligrams of combined EPA and DHA daily, with a focus on higher EPA. And you can find them in fatty fish, walnuts, and eggs.
And let's elaborate on SAM. You mentioned it supports methylation. For the listener, what is methylation and why does it matter for mood?
That's a great question that needs clarifying. So S-adenosyl L-methionine, or SANED, is a compound your body produces naturally. Think of methylation as a chemical assembly line. It's a metabolic process where a tiny little methyl group is transferred from one molecule to another. And this is crucial because this assembly line helps your body create and metabolize key neurotransmitters like serotonin, dopamine, and norepinephrine.
So by supplementing with SAM, you're essentially making sure that assembly line has enough raw materials to produce and regulate the brain chemicals that light deprivation is weakening.
Exactly. Supplemental SAMe supports this methylation process, and that can potentially improve mood in people with mild to moderate depression. Typical doses range from 400 to 1,600 milligrams per day. It's generally well tolerated, though you should watch for potential side effects like nausea or dry mouth.
And B vitamins are also often cited in this process.
They're crucial cofactors. B vitamins, specifically B6, B12, and folate, play an essential role in brain health by acting as helpers in that methylation process. They assist the body in manufacturing those mood-affecting neurotransmitters. Deficiencies are linked to depression and fatigue, so improving your intake through supplements or a diet like leafy greens, whole grains, meat, and fish can support your overall mood and energy when the season is dragging you down.
Before we move on to lifestyle, we have to issue a serious safety warning about one popular herbal supplement, St. John's wort.
This is a critical, non-negotiable warning. St. John's wort is sometimes used for mild to moderate depression. However, it can interact dangerously with a huge variety of prescribed medications. I'm talking about many antidepressants, birth control pills, seizure medications, blood thinners. It can lead to serious, even life-threatening side effects like serotonin syndrome when you combine it with SSRIs. Plus, it significantly increases sun sensitivity. You must consult a healthcare provider before taking it, under any circumstance.
And beyond supplements, the sources really emphasize the undeniable power of basic lifestyle strategies, movement and diet, which are completely within your control.
Simple physical activity cannot be underestimated, especially for SAD. Exercise releases those feel-good chemicals, serotonin, dopamine, endorphins, which directly counterbalance the low-mood chemistry of SAD. It also helps relieve the stress and anxiety that often comes with depression.
You referenced a groundbreaking study that linked exercise to vitamin D levels, which suggests movement itself is protective against these seasonal dips. Let's spend a moment on the implications of that finding.
That study was fascinating. It found that participants who followed a 10-week indoor exercise program had a smaller drop in their vitamin D3 levels over the winter compared to those who didn't exercise at all. And while the exact mechanism is still being studied, it strongly implies that movement isn't just helping with mood, it's somehow helping the body maintain its fundamental seasonal balance. Maybe by boosting circulation or hormonal function that supports vitamin metabolism, it suggests exercise is a holistic biological countermeasure to the seasonal decline.
That reframes exercise from just being a weight loss tool into a necessary biological intervention during the winter. And briefly on diet, how do you handle those intense carb cravings that are linked to SAD?
The primary goal with diet is stability and managing blood sugar spikes. Since winter SAD often involves those carb cravings, try to focus on complex carbohydrates, whole grains, beans, oats, rather than overindulging in simple sugary treats. Those just give you a quick rush, followed by a crash that makes fatigue and mood even worse. Focus on a balanced diet rich in those mood-boosting foods like omega-3s and B vitamins. Also, to help normalize your sleep, avoid alcohol and caffeine, especially in the evening, as both can sabotage your ability to establish a healthy, synchronized circadian rhythm.
It all just keeps coming back to light and structure, that Amish insight that people who spend more time outdoors have lower SAD rates. It really just underscores that maximizing natural light and movement are powerful, accessible tools for everyone, regardless of whether they need clinical treatment. So since SAD follows such a highly predictable pattern, often starting in, say, late September or early October, we have this unique advantage of being proactive. This isn't like treating an unexpected illness. How can you get ahead of the symptoms rather than waiting for them to hit their debilitating peak in December or January?
Proactivity is the hallmark of effective SAD management. And the first step involves rigorous, unwavering attention to maintaining stability and routine. This directly combats that disruption to your circadian rhythm.
And routine means being consistent, even when that biological urge to hibernate is strongest and your bed feels like the only safe place in the world.
Precisely. You have to fight the hypersomnia. Maintain a strict, routine sleep schedule. Go to bed and wake up at the same time every single day, and that includes weekends. This consistency is essential to normalize and anchor your circadian rhythms. Also, reduce or eliminate unnecessary napping and oversleeping. You also need to maintain a regular structure for your meals, for work, for family activities. Structure acts as an external anchor when your internal clock is drifting.
And in terms of cognitive strategy, how do you use that reframing technique we talked about earlier, even before the symptoms begin, to plan your defense?
You practice actively reframing those negative thoughts about the season. You consciously adopt the thought, winter is harder, but I can plan around it. And this leads directly to planning for behavioral activation. You need to plan your winter pleasures proactively. Embrace cozy rituals, schedule social time, and crucially, schedule outdoor or stimulating indoor activities, whether it's committing to a winter hiking group or just a standing weekly coffee date. You are deliberately choosing structure and pleasure to counteract that depressive pull.
And beyond the light box, how can we maximize natural light exposure in our daily lives, especially during those vital morning hours?
You need to make your environment work for you. Open your blinds wide the moment you wake up. Sit closer to bright windows at home or at work to catch whatever light is available. You can even consider using high-lumen full-spectrum bulbs indoors, especially in the evenings, to keep your environment sunnier and counter that early darkness.
And the simplest advice is the hardest to follow when it's cold. Get outside.
Yes. Increase your outdoor time, even on cloudy days, because even that diffused natural light is significantly stronger than any indoor artificial light. It helps regulate your mood. The recommendation is to try to get outside for a few minutes without sunscreen or sunglasses, when it's safe, of course, particularly within the first hour or two of waking up. That early exposure helps maximally reset the circadian clock and suppress melatonin.
And finally, as we close out, we just have to reiterate the safety component regarding supplements and medical consultation.
This cannot be stressed enough. Always consult a healthcare provider or a pharmacist before you start any new supplement, whether it's vitamin D, SAM-E, or any herbal remedy like St. John's wort. The risk of interaction with prescription medications you may already be taking is serious. This is non-negotiable for your safety.
And if the symptoms become debilitating, professional intervention is essential.
If your depressive symptoms last more than 2 weeks, if they intensify or if they begin to interfere significantly with your ability to function in your daily life, you must talk to a medical professional. Do not delay seeking care, as SAD is highly treatable. And if you or someone you know is struggling or having thoughts of suicide or self-harm, please use the 24/7 crisis resources immediately. You can call or text the 988 Suicide and Crisis Lifeline. So to summarize this entire deep dive, seasonal affective disorder is a serious subtype of major depressive disorder with a predictable seasonal pattern. It's primarily triggered by the reduction in daylight hours. This lack of light disrupts the body's master clock, the SCN, which leads to a phase delay in the sleep cycle and that hyper-efficient disposal of mood-regulating serotonin. And these factors result in those specific hibernation symptoms of oversleeping and intense carb cravings. But because we know the cause, treatments like high-intensity light therapy, specialized cognitive behavioral therapy, and strategic medication offer highly effective solutions. Inconsistent routine, movement, and aggressively maximizing your outdoor light exposure are indispensable proactive tools.
It's just so powerful to realize how deeply rooted our fundamental mood and brain function are in the simple external presence of light. The sources detail that the body's master clock uses light to time all these essential functions, including the production of serotonin and the signal to stop melatonin. Without that sufficient light input, those rhythms just naturally drift out of sync. And that leads to that biological signal where, as one expert put it, Mother Nature thinks people should shut down for the season. Oh, wow. So here's the provocative thought for you to carry forward, especially in the face of that biological imperative. If our body is naturally built to slow down and retreat in winter, if that SERT protein is vacuuming up your joy and your clock is telling you to sleep, how might the deliberate, scheduled action of engaging in joyful, stimulating, and timed activities, what the therapists call behavioral activation, how might that act as a powerful psychological counterforce to this natural, deep-seated biological impulse? It's not just about turning on a lamp for 30 minutes. It's about deliberately choosing structure and pleasure every single day to maintain your wellness when your ancient biology is telling you to hibernate. This is truly knowledge for application year after year.